Okay. Well, hello and welcome to today's webinar. My name is Jenny Tacito and I'm going to be kicking things off today. I am just going to give a moment to make sure that everyone's connected to your audio and are ready to participate in the webinar, and then we'll get started. But I just want everyone to know what you're here for today. We are doing a webinar on brain and body rebooting, which is the idea of harnessing neuroplasticity with LSVT LOUD and LSVT BIG. So we'll start with just a little bit of introductions. I am a physical therapist, and again, my name is Jenny Tacito. I am currently the Director of Communications and Innovation for LSVT Global, but I have a background of 21 years of clinical practice working with people primarily with neurological disorders and with a focus and an expertise in Parkinson's disease. So I did that, and then I have taught courses for LSVT Global for years and years, and eventually transitioned over to the Director of Innovation and Communications. I am joined today by my colleague, Jessica Galgano, who is a speech language pathologist, and she's there to wave at you right now and say hello. Jessica is a speech language pathologist who runs her own private practice called Open Lines Speech and Communication. And she is a bi-coastal girl at this time, so spends her time between New York City and Los Angeles area with her private practice, with an expertise also in working with people with Parkinson's and neurological voice disorders, amongst a wide variety of other things as well. So I'm going to kick things off. Jessica will jump in a little bit. Here is a little bit more detail. If you want to know the nitty-gritty details about either of us, they're here. Feel free to read them on your own time. And I'm going to just do kind of some of those basic disclosure statements that we have some preferences. One, that I have a non-financial relationship with a preference for LSVT LOUD and LSVT BIG as treatment techniques. And our financial relationships is that I am an employee of LSVT Global, and Dr. Galgano is a consultant and receives both lecture honorarium from LSVT Global. A few logistical things that you might want to know right away is that everyone who is joining us will have your microphones muted as you come in. And we will have the ability to unmute microphones later and ask questions at the end of all of this. But for now, everyone should be automatically muted. At the end, we will take some questions. If you have questions that come up during the webinar, you can certainly put them into that chat or questions box that you have on your screen. Otherwise, you can save them for the end, and we can have you put them in at that point and answer them there, as we may answer your question midway through the webinar today. We do have handouts for this presentation, and they were likely being sent to you, or should have been sent to you via email prior to this, but we will drop them into the chat. I'll actually see if Jessica can maybe drop those into the chat for you guys while I'm talking here so that you can open them from there. At the end, we will have a brief survey that will pop up, and please complete the survey and give us your feedback. We love to hear from you on what you liked, what you'd like to hear more of, or any other topics like that. And if you are a physical, occupational, or speech therapist that is joining us today, you may be able to gain some continuing education units for attending the webinar. And there are some details here on self-reporting. We do not file for CEUs for the webinars themselves, but you certainly can self-report if your state allows that. Our objectives today are to really focus on the area of neuroplasticity, which for some of you, you might know, yes, I know exactly what that is. For others, it may be an unfamiliar topic that you're learning more about right now. So we'll define some of the core principles of activity-dependent neuroplasticity, summarize how those principles are utilized within the LSVT BIG and LSVT LOUD treatment protocols, and then hoping you walk away recognizing how activity-dependent neuroplasticity principles inform other treatment approaches, even beyond LSVT BIG and LSVT LOUD. So we are going to do a polling question here, and we just really want to know a little bit more about who you are, so that as we're talking today, if we're more dominant on one end of the spectrum than the other, we make sure we keep things really appropriate for our audience. So I am going to go ahead and just launch a poll here on who is joining us, and if you could just take a minute and give us a little information on who you are. We'll give maybe 30 seconds to let you guys put it in there. And certainly if I didn't encompass your category, the other category is there too that you could put yourself in. All right, well, it looks like we're still getting responses, so I'll give you just a few more seconds here. Perfect. Okay. Well, we look like we have a nice mix of people that are joining us today. So, like almost 15% are people that are already certified in LSVT BIG or LOUD. We have almost 30% of people who are physical, occupational, or speech therapists not yet certified. Almost half of you are people living with Parkinson's or another neurological diagnosis. And then we have a few friends, families, and other health professionals. So thank you all for being here with us today. We'll make sure we speak to all of you throughout this presentation. I'm going to close that off, and then we will get started with our content here. So just going back a little bit historically, the research and treatments that we had long ago really did not recognize the benefits of what speech and body exercise could do for people with Parkinson's or other neurological conditions. Historically, exercise was really believed to be a waste of time or even harmful, that it might increase underlying muscle tone issues. Little research was conducted. And a little quote from the speech aspect of things is that there was really no effective voice or speech treatments for Parkinson's as well. Voice treatments for disorders that are degenerative was controversial, since there was no expectation of recovery of function or that any improvement could be made with the speech language pathology intervention, and that it would not be maintained in the long term. We know today that these things are incorrect. And I hope you all know that listening today, that this is dated information from 30 years ago. And we had a lot of change that happened in what we refer to kind of as the decade of the brain. So this is referring to physical therapy trials, but we saw the same things happening in speech language pathology research. Was that in the 1990s, there was this explosion of literature and research on the idea that people with Parkinson's and other neurological disorders actually can get better, that it's not just a life sentence you're given and you have to accept it, but instead the idea that with the right therapy, the right intervention, you can take these symptoms that this diagnosis is causing and actually improve them. And beyond that, research continued to support the idea that you could get those improvements to stick or to stay, right? So that they would stay long term or longer term with, of course, intermittent tune-ups, revisits with your therapist, all of those kinds of things. So we really saw that huge increase in literature that helped support what we were doing. I think back to graduating from physical therapy school back around the year 2000. And even at that point in time, the literature had not yet made it into my graduate education program. So thinking about that it was really not until probably into the 2000s that we really saw some of this research from the decade of the brain catch up with actual education of people in physical therapy, occupational therapy, speech therapy programs, where they started teaching more of this, which has continued to increase throughout the years and to today. The education that therapists get today about the possibilities for people with Parkinson's and other neurodegenerative disorders is so much better than it was when I graduated, or even when Jessica graduated from school all those years ago. So part of that information we received was that idea that we can get better, and we identified principles that will help with that activity dependent neuroplasticity, which basically is fancy words for describing what elements need to be present in a rehabilitation program, in an exercise program, in a voice or speech program, in order to maximize the possibility of changes, making those changes happen in the brain and laying down that foundation for that change in order for people to be successful. So this slide is a little on the technical side, but I'll do my best to kind of explain it, really how neuroplasticity plays a role in neurorehabilitation. So the neurons alter the structure and function in response to a variety of internal and external pressures, including behavioral training. And then the impact of this on the field of neurorehabilitation has been an emphasis on treatments that challenge the impaired nervous system through intensive, complex, and repetitive task practice. So what we really learned, and what we're going to go through in more detail today with you, is that there are key principles of neuroplasticity that need to be present in any treatment plan that you are doing, including that are embedded in LSVT LOUD and LSVT BIG. But we're also going to talk about how do you carry those things over then into other things you enjoy, other exercises, social situations. So when you leave us today, you should have some more explanation of that. But through all of that research, we're able to identify those key things that need to be present in a treatment program. So what did we do with that? Well, we got the neuroscience, the research. How do we translate that then over into rehabilitation? And this is a lot of times where things fail, is you can read a ton of research articles on something that talk about something in broad terms, but they don't quite give you, now here's what you do next. So what we wanted to look at and talk about today is how do we take what we know from the science and apply it to actual rehabilitation, so that those of you that are listening today, living with a neurodegenerative disorder, get the best treatment possible for you. So there were studies to look at that neurobiological phenomenon and identify those principles to help guide us in creating programs that will help optimize that neurorehabilitation that you receive. So what that looked like is, this is an example of, of exercise, is certain elements of exercise need to be present, such as things need to be repeated often and frequently. So we know that trial and error learning is inherently slow. So when you do something and you don't get the response that you expected, we need to do it again, and we need to do it again, and we need to do it again until you can actually self-select the right amount of effort, so that when you do that on your own, you can repeat it at the right amount of amplitude or effort that's needed. And that's true for voice, it's true for movement, for completion of activities of daily living. So repetition's key. We also know that intensity is really important. It has to be hard enough that it's challenging you. So if you are the person receiving the therapy, you need to really feel like you are being challenged by the treatment you're receiving. Because if you're not, and it's too easy, then you're likely not getting the maximum benefit of what you need. And challenge is a different level for every person. Some people who are newly diagnosed, maybe young onset Parkinson's, exercise people, fit people, your level of challenge needs to be way up here to really be able to challenge you. If you are someone who's maybe a little older, have more of a sedentary lifestyle, your challenge level may be here, and that you feel that same level of challenge that that other person felt way up here. So as therapists, we need to make sure we're challenging our patients appropriately, making them work at the right amount of level so that they do get that benefit. And then we want to add in that cognitive engagement as well. Dual tasking, where maybe you are trying to keep your voice loud while you're shuffling cards at the same time, or you're trying to keep your walking big while you're digging in your purse for your cell phone. So, thinking about that dual tasking, they are real life things we do on a day-to-day basis that we need to be able to keep our level of amplitude of voice and movement up for. So we'll talk about, what is the goal in therapy? It's really to incorporate those multiple principles of neuroplasticity into our treatment that we are delivering as therapists, or knowing that that's a part of the treatment you are receiving as a therapist or as a patient or person living with a neurodegenerative disorder. So here are some of those key principles, and we talked about a few already. Intensity is really important. Are you working hard enough? Are you working your patients hard enough to really achieve the outcomes that you're trying to obtain? Is what you're doing complex enough? We are multitasking human beings. So are we layering in dual tasking, complex tasks in order to make sure we're getting the best benefit? Are we doing enough repetitions to actually produce the brain change that we need so that you don't have to think so much about it anymore and that you instead just can auto-select moving at a bigger amplitude or speaking with a louder voice that would be considered normal? So where our goal is always normal, normal as you were prior to your diagnosis. Salience is a funny word, and I'll be honest with you, when I took this course as a physical therapist, I had no idea what that meant. So if you don't know what that means, that's totally normal. It basically means you should be doing things that are important to you. So your therapy, if you're a person receiving therapy, should be focused on functional tasks, speaking tasks, communication tasks that are critical to you, that are important to you. And so your therapist should be asking what is important. And then as therapists, we need to make sure that we're integrating that into our treatment, that we're really addressing the things that our clients want to be working on, improving or getting better at. Timing is also really important, and we'll talk more about this in a bit, but the sooner the better, but it's never too late. And then the last one is that specificity, is we should be practicing specific things in a specific way, meaning that if you want to be better at putting your jacket on, you should be practicing putting your jacket on. If you want to be better at speaking in a crowded room, you should be practicing in environments where it's crowded and loud and you're trying to keep your voice loud. So Dr. Galgano will talk a little more about those as we go through all the details here next. I'll turn it over to you, Jessica.
Thank you so much, Jenny. So what we're looking at here, this slide now introduces three foundational elements of LSVT therapies, both LSVT LOUD and LSVT BIG, that promote neuroplasticity. So we'll talk a little bit more about the treatment target, the mode of treatment, and calibration. So the LSVT therapies are built on principles of motor learning and neuroplasticity. These principles are essential for driving that long-term, meaningful change in overall movement patterns as well as speech and voice behavior. So I want you to think of these as the keys to therapy success. Our treatment target is focused on increasing amplitude of movement. So as Jenny was mentioning, in our case, in the speech pathology world, our focus is amplifying vocal output, specifically vocal loudness. But we're also looking in LSVT BIG to increase the amplitude of overall fine and gross motor movement across the whole system. Now, our mode of treatment is delivered with high intensity and effort. We use repetitive, complex, and progressively challenging tasks. And the whole point of this is calibration. What your therapist should be aiming to do with you is help you recognize that the typical amplitude of movements you might use, the typical voice that you might use, might be quieter, might be slower, might be less big in terms of movement. And the treated movement, the treated voice, the treated posture and walking that initially feels like it's too much, it's too big, it's too loud, is actually within normal limits. So we're retraining sensory motor perception. And these are not random concepts. They're aligned with neuroscientific findings on how the brain reorganizes with task-specific, effortful practice. So I want to dig into our first key, our treatment target. The key concept here is specificity. So what neuroplasticity research shows us is that the nature of the training determines the nature of the change. In other words, you get what you train. So if you need louder speech, you're not just training yourself in these random vocal tasks. Your therapist is directly and specifically training vocal loudness for improvement in overall speech intelligibility and communicative success. And this really aligns with principles of motor learning and supports the use of amplitude-based voice and movement training like we see with LSVT LOUD or LSVT BIG. So I want you to think of this as precision practice. We are laser focused on the impaired domain, that reduced amplitude of movement. So now let's talk a little bit more about the specific physiological symptoms or targets that LSVT loud and LSVT big target, which are hypokinesia and bradykinesia. So these are really the hallmark symptoms in Parkinson's disease and are also present in other neurological disorders. Hypokinesia refers to reduced amplitude of movement, such as softer speech, which is called hypophonia. Or reduced amplitude of movement in the physical motor symptom. Bradykinesia, however, is slowness of movement. And we see these manifest as soft speech, tiny or illegible handwriting, something called micrographia, a shuffling gait or festinating gait pattern with a reduced arm swing. And the LSVT therapies combat these symptoms by driving that larger or bigger amplitude of movement through voice or general movement, which can also wonderfully influence other motor symptoms. So as we take a look at the next slide, what we're going to see are illustrations about how LSVT loud or LSVT big use amplitude as a core treatment strategy or mechanism to create a spreading of treatment effect or change. If you've been living with Parkinson's, you might notice that you tend to underscale those movements. And so when you're talking, it feels normal, but other people may be asking you to repeat or saying that your voice is too quiet. When you're walking, it might seem that people are walking faster than you versus you walking a little bit more slowly or with shorter or smaller stride lengths. And what the therapies aim to do is retrain your system to produce those larger, healthier movements, whether in voice or speech, as well as overall movement. And so note the visuals. What we're doing is we're driving amplitude to override that slowness in movement, the bradykinesia, or the hypokinesia, that reduced amplitude of movement. But it's not just about louder speech and bigger movements. It's about healthier and more functional movement and vocal and speech output. So this directly aligns with principles of specificity, intensity, and repetition that we know work in the field of neurorehabilitation. Now, one of the core challenges we address through LSVT Loud is impaired kinesthetic awareness. So that is a reduced or inaccurate internal sense of movement. And this is not limited to speech alone, to speech alone. In individuals with Parkinson's, what we know is that reduced amplitude of movement, it's going to impact both speech and physical movement, often without us realizing it. So just as you might notice your feet shuffling without noticing. You also may speak softly without being aware. That diminished perception of effort applies across systems. So, for example, you might feel like you're making a large gesture or using a strong voice when in fact both remain too small to be functional in daily life. And so, what's wonderful is that one of the primary goals in the LSVT therapies is to retrain that internal calibration system. So, we use increased amplitude as a therapeutic entry point, a singular, measurable target that drives these bigger, broader improvements in movement and voice. So, we're aiming to help you increase your awareness through education, through sensory feedback, through video playback. You begin to recognize that gap between what you feel and what's perceived by others, whether it's a small movement or a soft voice. Then we work on acceptance. Even after acceptance is gained, accepting that greater than normal effort is required to achieve everyday communication and movement goals, it can be really difficult. So we help you normalize this through repetition and the feedback we provide. Then over time, think comfort. With your structured carryover tasks, you begin to integrate all of these recalibrated motor behaviors in speech and movement into your daily life with increased comfort and increased confidence. And because this treatment builds on principles of motor learning and neuroplasticity, the changes aren't only functional, but potentially long lasting when you practice them consistently. So, what I want you to do is take a look at this next video that's going to demonstrate how a young man with early onset PD describes changes in his kinesthetic awareness and how this has affected movement and response to treatment.
I can't always tell if I'm leaning to a side. When the instructor says to extend your left arm, I may have it here. And if I'm not looking, I think, yeah, that's out pretty well. And she'll say, no, you can get that elbow straight, straighter, straighter, straighter. I'm not being lazy when I don't straighten that arm. Sometimes I feel like it's straight, but my brain gets a message, yeah, it's pretty straight, but that's not the reality. So it's important that the therapist is another set of eyes for the patient and encourages, I can get it straighter. I just thought it was already straight. I didn't know to keep trying.
Excellent. So now we move into mode, the second key concept in the LSVT therapies. And we have three principles here. Intensity, we want our treatment sessions to be high effort and very frequent. Repetition, because multiple trials is really what's going to build that automaticity in more typical movement patterns, and complexity. So as soon as it becomes a little bit easy and you're getting good at it, well, we're going to make it more challenging. This is because these mirror principles found in the neuroplasticity and motor learning research. As Jenny mentioned a few minutes ago, the brain changes with practice that's hard enough and repeated enough. Now, LSVT is not just casual practice. It's designed with intensity in mind. And so our dosage is 4 sessions a week for only a month, each session lasting 60 minutes with daily home exercise and carryover exercise to make sure it makes a difference in your day-to-day life from day one. And this is not just to hit a number. This intensity is essential for driving neuroplastic changes, really building the habit of using a louder voice and bigger movement patterns every day, and mirroring the intensity used in successful therapy programs for movement recovery. And we see that the intensity of a treatment, again, here is important for change. Traditional methods of therapy that are delivered at a lower dosage, fewer days per week or less number of minutes per session, they're just not as effective. I want you to think about those things that you do intensively every day. Think about the difference it makes in your life with the changes that you see. And then conversely, think about the other types of things that you do and the type that you do only with low frequency, and the change you could potentially make with them if you practice those things more regularly. So frequency is a very important component of the intensity that we've been talking about. But frequency is also very important and thinking about it in terms of repetition. So thinking of intensity through the repetition of practice. And this quote is a very good one. Don't practice until you get it right. Practice until you can't get it wrong. And I think it really reflects this legendary golfer's photo here, which is capturing the heart of LSVT's philosophy. This distinction is very critical in neurorehabilitation. It's not just about making a voice louder, making your movements bigger once or twice. It's about making those greater amplitude of movements, the louder voice, the bigger movements, automatic, habitual, and reliable, no matter where you are or what you're doing, really across all contexts. So though that high frequency, high effort session or repetition, in LSVT LOUD, can be over 500 vocal tasks across that 4-week protocol, what LSVT is doing is rewiring your motor system for lasting change. And so we're really aiming at that automaticity. That's when you stop thinking about it and you're just moving big and speaking loudly and you're just doing it. So it really aligns with the motor learning literature that we know. True skill acquisition will occur when you're practicing the behavior consistently without conscious effort, even under stress or distraction. And so, again, this slide here embodies that we want that high effort all session, every session. We want you to sustain vocal loudness, not just in your ahs or your discrete exercises, but in all of those conversational contexts as well. Repetition will solidify your motor plan. We'll move towards accuracy with progressively reduced external cueing. So it's building your internal calibration. So you begin to self-monitor and self-correct. And then, of course, we'll push you to a healthy fatigue. We want you to leave feeling, at least in the speech pathology world, my voice feels used, not abused. And that's the feeling of progress. So this intensity aligns again with principles of neuroplasticity, effortful, repetitive, meaningful activity over time that leads to lasting brain change. And so you're going to see that those 16 1-hour sessions over a month is really purposely designed in LSVT LOUD and BIG to push that motor system to adapt. So this video that we're going to see next is a reminder of what this therapy looks like in practice, what driving big intensity looks like in your day-to-day treatment sessions. You'll see a therapist here actively coaching amplitude, helping that client push their limits in a structured, high-effort way. And that same concept of driving effort applies to us as speech pathologists in LSVT LOUD. We'll see that next in a follow-up video. You're going to see that Jenny doesn't settle for minimal effort. She's encouraging her client to stretch their capability with the goal to create a therapeutic environment where intensity becomes the expectation, not the exception, whether it's movement or voice. You're going to see that effortful practice leads to neuroplastic change, and that's true whether we're retraining movement patterns or speech motor patterns. So while this video is from the physical therapy domain, let it reinforce also what we do in voice therapy. We drive intensity, we coach persistence, and we push beyond comfort zones. So let's take a look at this video now.
Okay, now on a scale of 0 to 10, 0 being no effort at all, 10 being the hardest effort I can give, where are you at right now?
3.
Oh, we got to kick it up a notch, okay? Yep. You ready?
Yep.
Here we go. Big reach. Stretch those fingers big. Down big, up big, back big, hold with that big posture, loud voice.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Big finish. Was that more effort?
Yes.
All right, let's.
Excellent. And what we're going to see on in the next video is the core dynamic of LSVT Loud. You'll see Angela, the therapist, as an active coach. You'll see her client fully engaged in delivering this high effort vocal output. And I want you to notice that visual cue in the middle, that think loud. And that's more than a slogan. It's a mental and behavioral refrain. We want you to adopt this as a mindset throughout the session and beyond. So you can see that driving intensity means pushing effort from the very first minute to the last, monitoring and maximizing amplitude in every vocal task, and maintaining consistent cueing, modeling, and feedback. You'll see the therapist not just as a passive observer, you'll see her coaching, motivating, and calibrating to help this client understand that what might feel loud is really at typical limits.
Keep it going. Keep it loud. Good. Keep going. Keep going. Keep it loud. Okay, great. Excellent.
Great, and I think that's a nice example of what therapeutic intensity in practice looks like. It's structured, it's purposeful, and there's a relentless focus on effort. So if you start mastering a task in LSVT Big or LSVT Loud, hopefully your therapist is not letting you plateau. That is the perfect point to increase complexity. And so what you're going to see here is that challenge drives that plastic change at the level of the brain. We don't want you to stay at the same level. We're going to add cognitive, motor, or communicative demands, as you saw in the previous videos. We want to incorporate dual task challenges. So we'll make you walk and talk at the same time, or find something and or do something, think and talk while you're moving. And these unexpected challenges or distractions or real world simulations are really maximizing the brain working. So let's take a look at what functional complexity looks like when using LSVT Loud or LSVT Big.
Game started at 8 o'clock in the morning, so we had to be up early.
Get that towel all the way in the basket.
The
Keep it fish.
competition was very minimal. We walked over.
Okay, great. And what we see next is that your clinician plays a key role in helping you scale complexity across all parts of the LSVT protocols. In LSVT Loud, we'll do that whether you're doing your long or high or low ahs, doing functional phrases or hierarchical speech tasks. Physical and occupational therapists then do the same. What we're doing is we're considering how cognitive load, emotional context, and communicative purpose is embedded throughout each layer or part of therapy. And so as you progress in the therapy programs, we make those activities and tasks more real world, unpredictable, and demanding. So it really helps you generalize and adapt these bigger movements and louder voice to day-to-day life. And so some examples might be talking on the phone while you're walking, reading aloud with that nice loud voice while also balancing or multitasking, sustaining vocal effort while solving math problems, adding noise or distractions or time pressure. And we also vary the context. Have you practice in restaurants, over the phone, different environments with multiple people. So we're randomizing practice to help enhance transfer or carryover or generalization to real life environments. And I love this because it really mimics the unpredictable nature of life, whether we are communicating or moving in a way that helps us make gains more functional and last over time. So finally, the third key concept that we focus on in LSVT Loud and Big is called calibration. We are helping clients recognize and accept that a new, louder voice is normal. It's typical. Same with the movements. Movements might feel big, but they are typical amplitude within normal limit level. And so the idea is that even if you achieve loudness and big movement in therapy, you still have to carry that perception into the real world. And that principle of salience that Jenny mentioned, that meaningfulness, that importance in your life really comes into play here. We've got to do some training as therapists that is personally meaningful for you to help make it stick. So we want exercises, activities, tasks that we do to be intrinsically rewarding. We want them to connect to your goals and evoke emotional and motivational responses. Now, research supports that plasticity is experience dependent and that salient, rewarding experiences are way more effective. So we tailor tasks to your goals, speaking with grandchildren, ordering food at a restaurant, presenting at a conference, reading bedtime stories. And these emotional connections will reinforce how motivated you are. That will then drive engagement and change. And what we say in speech pathology is that a client's voice needs to become not just louder, but also functionally relevant in the activities you care about. So we want to use salient or meaningful activities to help you experience a positive impact on function, even outside of the therapy room. So the next slide drives home the intentional connection between the LSVT exercises, functional movement or speech, and real world goals. And this is because therapy is not isolated. We must link the drills and the basic exercises in these programs to meaningful life tasks to ensure the carryover that we're aiming for. We don't want you, again, louder or bigger moving in just the clinic. We want you louder and more confident with bigger movements everywhere you go. So this is what will build that independence, that autonomy, have that real life impact that you are looking for. So we're really making sure that these changes are meaningful to you, not just the therapist. So in the next video, you're going to see a woman, her name is Phyllis. She is an LSVT graduate who really embodies the importance of connecting treatment to meaningful functional movement. And Phyllis really reminds us that it's not enough to do exercises in the clinic. What matters most is how these exercises impact her daily life, her independence, her relationships, her ability to function day to day. And this concept she speaks to is really at the heart of the LSVT approach, linking exercises to functional goals. We don't just train voice, we don't just train movement, we do it within context. And so that way, when we talk about calibration and salience, this is what we mean. We've got to connect therapy to the person's lived experience, no matter what you are doing. So let's take a look at Phyllis's perceptions now.
Even the exercises that I took from physical therapists and occupational therapists that were not connected with LSVT, nobody told me the functional purposes for these. And so I just considered them exercises and I never did them again. You know, if I don't see a reason for them, I won't do them. So I'm a person that has to have a reason to exercise. And if it means that I will be more functional in my daily living, in whether it's handwriting or whether it's taking a shower, or getting dressed or whatever it is, or watering my plants, whatever happens to be functional for me and it's important, then I think I want therapists to come up with ideas on the exercise that will help that.
Excellent. And so when you see the direct value of LSVT in your everyday life, you're not just training your voice or ability to move within life, you're rebuilding your confidence and your connection to it. So this last bonus principle to highlight is timing. Early intervention matters. Neuroplasticity is more robust in the earlier stages of motor system impairment. So encourage early referrals, even if changes are mild. Acting early can preserve function, confidence, and social participation. Also, therapy timing within a session matters. And so we want you to start strong. We want you to end with high effort. According to one of the research studies that's listed here on this slide, injury or neurodegeneration creates a fertile environment for change. But behavior, in this case, rehabilitation, is needed to guide that plasticity in a positive direction. In Parkinson's disease, early intervention with LSVT LOUD or BIG may actually slow the progression of those deficits that are being noted. But that said, it's never too late. Research shows that individuals at all stages of Parkinson's can benefit from these therapies, though earlier initiation may yield more robust and functional improvement. So early intervention is key for optimal brain reorganization and outcomes. So the last couple of slides I'll present on until I pass this back over to you, Jenny, include really key principles of neuroplasticity. And this slide represents what happens without rehabilitation. It's a negative or vicious cycle. So clients begin with a softer voice or reduced movement. This leads to less successful communication, frustration, avoidance, social withdrawal. And withdrawal then leads to even less voice use, even less participation in things that you do day to day. That then reinforces deconditioning and reduces neural activation of motor systems. So this is that use it or lose it principle in action. Without the timely and targeted intervention, this cycle often accelerates in Parkinson's and other neurodegenerative conditions. But there is great news. Rehabilitation interrupts that cycle and replaces it with a positive self-reinforcing loop. So with LSVT therapies, you receive salient, meaningful, intensive voice and physical training. You will improve loudness and intelligibility. You'll improve movement, walking, balance, and gait. You'll have better communication and participation outcomes. That will then make you more confident. It'll lead to greater social participation and more success in daily life. And as you continue to use that louder voice in functional settings, or bigger movement in functional settings, you further reinforce those healthy behaviors and you start to use it and improve it. So that cycle of success then supports long-term maintenance and lifelong carryover. So now, Jenny, I'll pass it back to you to talk about all the specific neuroplasticity research that has been shown in LSVT as a result of LSVT LOUD and BIG.
Thank you, Jessica. So we're just going to kind of highlight some of the research behind LSVT as far as neuroplasticity is concerned. So we talked in the beginning about the decade of the brain, the identification of these key principles of neuroplasticity that should be present in treatment. We've walked you through some of those key pieces and how we use them in LSVT LOUD and LSVT BIG. And so then do we have evidence that says that this actually does help and actually works? So we do, and I'm not going to go through details of all of these studies for you, but if you are a scientific person or research person on this webinar, I wanted to give you some references of things to look at where we did look at some of the neural changes that happen with LSVT BIG in some of these published studies that were out there. I shouldn't say we, other people did these studies, not us. But looking at improvements in the United Parkinson's Disease Rating Scale, which is a scale that often is done with a neurologist. You may not even know they're doing it because it's kind of some regular testing they might do with you. There was a look at improvements within the motor scores in both part 2 and part 3 of that. as well as improvements in non-motor signs and symptoms of Parkinson's that were found through using LSVT BIG treatment. There was also a study that found proprioceptive improvement and improvement in dual tasking ability as well. These all show evidence for neural changes that can happen as a result of treatment with those principles of neuroplasticity. And in the LSVT LOUD world, there were really 4 foundational studies that examined the neural mechanisms underlying LSVT LOUD in Parkinson's disease. And they're listed here, and you can see they span from 2003 all the way to 2022. Many of these studies used PET scans and functional MRI to look at the results and the actual change that is happening in the brain for us to be able to say that yes, change is seen. There is increased activation, use of different areas of the brain that has come to be more known as a result of this research and these studies that have been done. So if you're very scientific, there's some good references for you to look into if you want to read more on the actual research. If you are a clinician, so if you are a physical occupational speech therapist or another allied health professional that's joining us, things to think about as a clinician is that intensive therapy drives neuroplasticity. So really, don't apologize for a demanding practice schedule. Clinicians will say, well, I have a hard time getting my patients to commit to the 4 times a week for 4 weeks. I always think if I really knew, as a person living with the diagnosis, if I really knew how important it is to have that intensity, would it be as much of a concern for me? And for me as a clinician, I rarely struggled getting people to commit, I think because I was so excited about their possibilities for improvements and that I knew they could get better with this intensive treatment schedule. So, really stand behind the science and the need for intensive treatment in order to achieve the results that we want. I always think for myself, I would want a physician or a therapist to recommend what is the best treatment for me with what I am dealing with. So, and lay it out for me. Let me know what's required and I will make it work. We also know that neural changes are measurable and meaningful. So we are facilitating genuine brain rehabilitation with the therapy we're doing when we're implementing those principles of neuroplasticity. And the sensory feedback system is key. So this really does help clients to recalibrate their movement and voice and their self-monitoring. So don't underestimate the importance of that sensory feedback system. It is very important that your clients, your patients, are able to begin to self-recognize the volume of voice that is necessary to have a normal volume and the amplitude of movement that is required to actually have a normal movement pattern when they move about in the world. Implications for clients. So if you are someone living with a neurodegenerative disorder, really knowing that it's not just behavioral training, it is actually brain rehabilitation. It's neural rehabilitation. When you're being guided through intensive voice or body exercises, it's not just exercise. You are actually working on genuine brain rewiring. And knowing that can help you understand why the intensity is necessary, why it's important to make time for 1 month in your life to do this intensive therapy, because it matters. We know that intensity is necessary. We know that a certain dosage is necessary in order to create the results that we want. And if I'm going to dedicate my time and my effort, I want you to get the best out of what you're getting. And I want you to want the best for yourself as well. So intensity is important. But set realistic expectations that changes take time. So if it's hard and it's frustrating and you feel like you're getting things wrong in the beginning, it's okay. That's 100% normal. So, give yourself time. Give yourself the gift of patience that it will come. It will get better. With these repetitive sessions with my therapist, I'm going to be successful. I'm going to learn what I need to do. And then that home practice is so important. So knowing that as a person receiving therapy, I always tell my clients, it's like taking a medication for Parkinson's. If you don't take your medication, it doesn't work. If you don't do your daily dose of home exercise, it doesn't work. So making sure you're thinking of your home practice, your home voice exercise, your home movement exercise as that daily dose of medication, that you're helping make those neural connections stick. And then outside of LSVT Big or LSVT Loud, say there's a different treatment approach that you're applying or that you're involved in receiving, are these principles present in what is happening? And if they're not, what can you be doing to help bring these principles into another treatment approach that you might be providing? So does the training provided match what you're trying to improve? Is that specificity there? Are you actually practicing sit to stand if sit to stand is difficult? The intensity across dosage are you getting enough? Are you providing enough therapy? Are you as a patient getting enough therapy that's reflective of the science and what we know in dosage, as well as effort? Are you working hard enough to produce changes? And are you cueing your patients enough to actually create that intensity and that effort? Are you doing enough repetitions? And then the idea is more possible and is it appropriate? So as I said before, the level of intensity is different for every person. So making sure that your therapy is targeted towards the right level of effort for them and is more necessary to produce those results, then adjust to more. And then complexity, is treatment progressing over time? So it should be getting harder. As you get better, we're going to make it harder. I had a patient once tell me that she goes, I sit at home at night and think about, oh my gosh, what is she going to make me do tomorrow? It should be exciting and entertain, working hard and layering in new complexities each time you work with a therapist. And are those real world tasks being practiced? So that real world communication, real world functional tasks being practiced as a part of treatment. And is intervention being provided at the ideal time? This might be different for different etiologies of disease or injury. Generally, what we know from the research is the earlier the better, but there may be other extenuating circumstances that might make that decision different. So in summary, neurorehabilitation and exercise evolved from being considered ineffective or even harmful to now recognized as medicine for neurological diseases and injuries. The fundamental principles of neuroplasticity, including specificity, intensity, complexity, repetition, salience, and timing, are all key factors that should be present. LSVT Big and LSVT Loud have taken those key neuroplasticity principles and operationalized them into a standardized yet individualized treatment protocol for people with neurodegenerative disorders. Successful neurorehabilitation incorporates those principles in any kind of rehabilitation to drive that activity-dependent neuroplasticity. So just a brief thing. I know some of you have already been asking questions in the Q&A section, and we're working on getting some of those answered. But if you do have more now, I know we're almost out of time, but Jessica and I will stay for just a little bit to answer more if you do have more. You also have the ability to raise your hand to ask a question. And of course, you can email us at any time after the webinar at that webinars@lsvtglobal.com if you think of something that you want to ask after the fact. Just a little alert that when you do leave us today, there will be a survey that pops up. Please respond to that, and it'll take less than 5 minutes to finish that. And especially if you're a therapist who's looking at self-reporting CEUs, you're going to want to complete that so you can get a certificate to self-report with. Another great thing is, if you don't know already, we have a podcast called Think Big and Loud. We interview experts and share insights, inspiring stories, all really designed to empower and uplift people. We cover a range of topics, from personal journeys. Not all things are related to Big or Loud. We interview a lot of people about their different programs, what they're doing, their success stories, clients, all those kinds of things. So follow us wherever you get your podcasts or on our YouTube channel. Okay, well, that is the end of my slides. So let's see if there are any questions that we did not answer yet. Oh, Jessica, there's one about, do you ever collaborate with music therapists for practicing the home exercises? That might be more geared towards you.
Yeah, so, though this program is specifically administered by speech language pathologists who are certified in the program, there is a daily home exercise program we have patients do each day. And so, whoever is with the patient on a typical day-to-day basis, if they also know those exercises and that plan, they are welcome to encourage that patient to do the exercises we prescribe for home exercise day to day. So in that way, absolutely, we encourage anyone to help our people with Parkinson's to do more.
Perfect. And a question of, will this recording be available? Absolutely. You'll find it also on our YouTube channel under our community webinars, usually within about 24 hours. So if you want to refer to that. And hi, Phyllis. Nice to see you. You guys all saw Phyllis in her video. It's always fun to share your amazing insights when you join us for webinars. Thank you for being with us today.
Great.
All right.
Excellent. Well, thank you so much, everyone. Have a wonderful day, morning, or evening, depending on where you're joining us from. And we look forward to seeing you at a future webinar.
Thank you, everyone. Goodbye.